scholars did. And John Simpson always says the old Hank syndrome. We need to move away from that. As part of that, this faculty has made serious efforts to recruit a scholar into this chair. Quite often it was a matter of fit. We were looking for outstanding people, and we continue to do that till this day. Recently we changed our plan that we are going to open the chair for consideration and competition by our colleagues from within the faculty, and especially those who are at the beginning of their academic careers in the area of cattle health. As part of that, we invited applications, and the first applicant is going to present today, and then we have 2 more coming up within this month. And so this is a great opportunity for us to listen from our colleagues whom we know and who have been engaged in research and application in the area of cattle health. Claire Windeyer, Dr. Windeyer, is a member of this faculty. She completed a degree in sciences from University of York, and then she followed it up with a degree in veterinary medicine from Ontario Veterinary College. And after that, she worked for a year in Fort Macleod as a veterinarian, then went back to Guelph to complete a Doctor of Veterinary Science degree. It's a very unique Guelph degree. It doesn't exist anywhere else. It's called BPSC. It's in the clinical science program. It's a combination of a residency program and a fairly strong research component. And then you complete it all in a 3-year program. It's a very intense program. So Dr. Windeyer did that. Following that, she joined this faculty, and last year she got tenure and promoted to associate professor. During this very short career as an academic, she has published large number of papers, trained many graduate students, and obtained large number of research grants from a variety of sources. In addition, she was part of Young Leaders in Cattle Health program, and she has done volunteer work in Nepal with the dairy producers in that country. So very strong international developmental focus that Claire brings, and she's very passionate about the program that we have developed in our faculty, whether it is teaching or research and so forth. So today Claire will talk to us about her vision for the Simpson chair, that how the chair can help us advance the knowledge in the area of beef cattle health. Claire, I'm very thankful that you put your name forward and you are here to share your vision for the chair with us. Will you please join me in welcoming Claire to her seminar.
And probably the first thing you shouldn't do when applying for a position is correct your dean, but it's actually Windeyer.
Oh. Well, that's English as my 3rd language, sorry.
I've been here, 6 years, 7 years now, and I'm finally confident enough to start correcting people on how to say my name. So it's actually...
Most of the people that forget Windeyer, right?
Yeah, it's how it's spelled, but okay. It's actually Windeyer. Like it's windier in Alberta. Yeah, so... Well, thank you, Baljit, and thank you all for coming to hear about my vision for the Simpson Ranch chair. I have been involved in the process of sort of trying to recruit for this chair for a while, so I've been actually thinking about this for quite some time. But when I sat down and actually tried to think about it and kind of put my thoughts on paper, I kind of found that I think the components of my vision fall into 3 main categories. And I like alliterations, so here they are. So to connect, contribute, and collaborate. And I'm going to go through each of these things separately and talk about sort of my vision for each of them. So we'll start first with connect. And when I thought about this, I think there's sort of 3 main opportunities for the chair to connect with stakeholders, and I'm going to go through each of them in turn, starting with before. So starting with, the 3 of them are before, during, and after. And I'll start at the beginning with before, which essentially means, when we are generating research hypotheses and study designs and things like that, I think before we even get to that stage, as applied researchers, we need to connect to our stakeholders and figure out what are the problems we actually need to be tackling with our research. So for this chair position, I think there's a few ways that this should be done, starting with listening to the industry, right? So this can be done through having conversations, fence post conversations or kitchen table conversations with individual producers and hearing about what they see as challenges for them. but also connecting with various diverse industry associations and all their different challenges and opinions and priorities. And I sort of identified this as something that needed to be done even at the beginning of my career here at UCBM. So as Baljeet mentioned, I actually applied for the Cattlemen's Young Leaders Program and was accepted to that, in which through this program I was matched with a wonderful mentor, Sherry Copperthorne-Barnes, and I was able to meet a whole bunch of young progressive producers as well as a lot of the leaders within the industry. So I've already sort of started this journey towards listening to the industry. As a vet school, I think the other major stakeholder group we need to listen to is the rural veterinarians. And we have a really special opportunity here at UCBM to connect with veterinarians through our DVLC. And I already have sort of started this journey as well through my role as the Rural Community Practice Liaison. I think it's also will be important for this chair to connect with organizations like WCAVP and AAVP, and I sat on the Beef Health Management Committee of AAVP, as well as ad hoc opportunities such as the Boehringer Bovine Advisory Board, which I have been a part of for several years now as well. Moving into the during component of connecting. Since I started here at UCBM, I've done a number of projects that involved surveying and interviewing producers to get their sort of perspectives on things, as well as trying to benchmark the types of practices that are currently going on in the field. So we've had a number of publications that have come out of that. So they have made their way into the scientific literature. And I'm just going to go through one example of one of these projects, which was the master's thesis of my student, Dr. Melissa Moggy, who is now working at AFAC, which happened to be our NSERC IPS partner, and now they've hired her on. So a nice success story there. And so Melissa looked at painful and stressful practices in cow-calf herds in Western Canada. And her project had two main objectives, or sort of groups of objectives. One was a quantitative aspect, which was looking at benchmarking animal care and health management practices and how those related to farm demographics. And the other was a qualitative epi component where she actually sat around kitchen tables with these producers and applied qualitative methods to the data that she collected in terms of their rationales for whether or not they accepted or rejected certain pain or stress mitigation practices. And so for this project, we collaborated with WCBM. It was part of the Western Canadian Cow-Calf Surveillance Network, which entails over 100 producers from across the 3 prairie provinces. And I won't go through all of her results because that would take us probably the rest of this time that we have, but one of the things, just to sort of highlight an example, we asked producers about their perceptions of pain in terms of calving. So in yellow, in yellow we have C-sections, in blue we have dystocias, so for those of you that aren't clinical, dystocia means a difficult birth. So on this side of the graph we have producers who agreed that this was a painful event, and on this side of the graph we have those who either disagreed or didn't have an opinion on the matter. So you don't really need to do stats to see that most of the producers perceived that calving was painful. We also asked them about what kind of methods of pain mitigation they used for a difficult calving. And I won't go through all the details of that, except to point out that less than half of our producers used any pain mitigation for something that they already told us they thought was painful. So we thought that was interesting. And then when Melissa sat down and actually talked to these producers about what motivated them to use pain mitigation versus what they perceived were barriers towards using pain mitigation, a number of themes came out of that, and these are some word clouds that kind of illustrate nicely the themes that we found. So on this side we have, in blue, the motivators, and we have over here, red, which were the barriers. And I won't go through this in detail either, but just some of the highlights. Things that motivated producers, a lot of them said it was a personal, conscious, and ethical choice. They just thought it was the right thing to do. Others saw that there was benefit to the calves or to their operation having done so. A number of them said their vets had influenced their decision making. And then on the barrier side, a lot of time, logistics, economics were some of the things that came up, which were understandable concerns. We have up here over in black as well, genetic selection. It's not really a motivator or a barrier. We had a number of people say, well, I make sure that I select big heifers and I buy bulls that give me small calves, therefore I don't have a lot of calving issues. So it's sort of an avoidance technique, which I think is legitimate. Interestingly, market demand came up on both sides of the equation, which was a bit of a surprise, and we kind of had to think our way through this one. Some of the people said, well, consumers want a welfare-friendly product, so we think using pain mitigation is part of that. The people who said it was a barrier said that consumers want drug-free meat. They don't want us to use drugs in our animals. So I think there's an opportunity to explore this further and try and figure out where we actually want to go with that. So just some conclusions from Melissa's work. Producers do recognize that calving is painful. However, a lot of them are not using pain mitigation strategies. Those that did were motivated by their ethics or perceived benefits. Those that were not were concerned about the logistics and economics of it. Another example of how we can engage with our producers and stakeholders during a research project. Sorry, Jen, I love this picture. She's in a calf cage. So we just finished this study last year. Jen's still working on the analysis. But one of her thesis chapters is a couple of her thesis chapters are looking at pain mitigation for beef calves that are assisted at birth. And so among the number of different projects, one of them was this large field study that we conducted this time last year, which is looking at the effectiveness of using pain mitigation at birth to reduce the impacts of calving, of assisted calving. And so this was no small feat. We enrolled 15 ranches through 2 veterinary practices. We were able to enroll almost 230 assisted calves during the calving season. We gave the producers 2 vials, one marked A, one marked B, one which had meloxicam and one had placebo. And so the producers were blind and they had a randomization protocol to follow. So they administered the product. Our team went out with between 1 and 3 days after the calf was born and collected a blood sample to check the passive immunity in those calves. And then we had the producers maintain treatment records, mortality records, and weaning weights. So any of you who are familiar with calving out beef cows in the prairies will recognize what a heroic feat this project actually was. So it was quite a bit of work, but we now have a really exciting network of herds that are willing to work with us and actually asking us, so what's the next project? What are we doing next? And so Jen's still working on this. We're still waiting for some weeding records, and she's doing her data analysis, so I'll let her present to you her findings when her public seminar comes around. But I just wanted to sort of use those as some examples of how we can really integrate with the beef stakeholders as we conduct our research. And then, of course, last but not least is the component of connecting after the projects are done. And so we have the opportunity of the UCVM Beef Cattle Conference, which I've been helping organize for many years now. And just a little sort of, while I have you here, I'll do a quick pitch, that this year we've connected with the International Symposium on Beef Welfare. And so we're going to be hosting the summit on June 19th to 21st, so you can mark that in your calendar. Other opportunities for connecting with producers include producer meetings, so whether that's small regional meetings or national webinars. Industry publications are still one of the major ways that we connect with beef producers, and so we were excited when our grad student was the cover story for Canadian Cattlemen. And then veterinary publications, not just scientific articles, but also gray literature that can access practicing veterinarians. So I put them in a list, sort of 1, 2, 3, but really this should be a circle, right? These things, in my view, in sort of the perfect world, are actually a continuing cycle of an ongoing process of connecting with the industry. So the next C is to contribute, and this is really the meat and potatoes of what I see this, I should say beef and potatoes maybe would be more appropriate for this, for this chair position. And I think for UCVM to be valued by the agricultural community and the rural veterinarians of Alberta, I think it's actually relatively simple. We need to contribute 2 things, and those being employable graduates and usable research. Probably the third being accessible clinical and diagnostic services, but that's probably a whole other discussion for another day. But I think this is really where this chair has an opportunity to contribute to the stakeholders. And so I think a nice example of this was the project of actually our inaugural Simpson Ranch Fellow, Dr. Elizabeth Homorowski, who did her graduate training with us here. And she graduated from that program board eligible for the ACVP, which she's now successfully passed. And she's been employed by one of our local practices that is quite heavy in consultation and in research services. So among a number of other objectives, one of Elizabeth's project objectives was to formulate a beef calf vigor assessment tool. And so she used a privately owned ranch here in southern Alberta, a large Hereford-based operation, and she enrolled calves during March of 2014. And I'll sort of just take you through some of the highlights because she found a lot of neat things, but sort of the most practical of which, we decided that the first thing a vigorous calf needed to do was consume colostrum, and they needed to do so by 4 hours after birth. And so when we looked at this, so here we have unassisted calvings, easy assist, which was a manual pull with 1 or 2 people, such as you see here, and then difficult assist was if they actually needed to use mechanical assistance in delivery, or what we call a calf jack. And we have here is in brown, we have calves that succeeded to consume colostrum on their own by 4 hours after birth, versus in green, calves that failed to do so on their own. And so you can see a nice little increase there. As the calving difficulty got worse, they were more likely to fail to consume colostrum on their own. Elizabeth did a whole bunch of different clinical tests and physical examination parameters that she evaluated at birth and looked at which of these factors predicted whether or not a calf was going to consume colostrum by 4 hours. And the most interesting one that came out of this was the suckle reflex. So you can see there, it's pretty simple. You just stick a finger in the calf's mouth and evaluate whether or not it has a strong reaction to that, and they try and suckle your finger, or they kind of don't know what to do with it. And when you break that out by strong versus weak, if they had a weak suckle reflex, they were 42 times more likely to fail to consume colostrum on their own within the first 4 hours. So we thought, we can maybe use this. And Elizabeth actually put those 2 things together and created this nice sort of flow chart for producers to use in making decisions about how they manage colostrum in their calves. And so if you break it out first by calving ease, and then you add on top of that the layer of the suckle reflex, you can actually predict how likely calves are to consume colostrum on their own. And so among our unassisted calvings, if they had a strong suckle reflex, 8% of those failed to consume colostrum on their own. So most of them did what they were supposed to do relatively well, but 78% if they had a weak suckle reflex. So that means even in our unassisted calvings that should be going about their day, doing what they're supposed to do, which is get up and suck colostrum from their mother, 3/4 of those are failing to do so. But generally we don't have our hands on those ones. They're the ones that are out in pasture and we're not necessarily intervening with. What's more interesting is probably these next 2 groups, which are assisted calves, because often those are the ones we're already manipulating. And so if an easy assist calf had a strong suckle reflex, 1/4 of those failed to consume colostrum on their own, 3/4 did what they were supposed to. Versus if they had a weak suckle reflex, 94% of those calves failed to consume colostrum on their own. And it's even more dramatic in our difficult assist. So if they had a strong suckle reflex, they were about 50-50, versus if they had a weak suckle reflex, they pretty much have a 100% chance of failing to consume colostrum on their own. So what this means for producers is that if you know how difficult the calving was, and you know what the suckle reflex of your calf is, you can make decisions about whether or not you want to kind of wait and see if this calf's going to go ahead and do what it's supposed to, so you don't have to get in the way of that bonding with the mother, or whether you want to get in there and do something and help make sure that calf gets the colostrum it needs. And this is also somewhat probably going to be influenced by the time of day, right? So if it's midnight, I probably don't like the odds of 50-50, but if it's 10 o'clock in the morning and I can keep an eye on that pair, I might let them go ahead and do what they're going to do. So I actually met a producer in the summer who said that he's been doing this on his ranch. He's got a large ranch in southern Alberta, and I was like, that's success, right? That made my day. So the conclusions from Elizabeth's, among some of the other things she found, was using a combination of calving ease and suckle reflex, producers can make informed decisions about their colostrum management. And so Elizabeth's work did result in 2 peer-reviewed publications, as well as the cover story, as I mentioned earlier. I think another opportunity for us to combine research with education of our graduates are the 4th year IM projects. So these are a neat opportunity that we have here at UCBM, and we've been working on one of these with one of the 4th years. We actually just finished data collection last week. But I think these are a really great opportunity to accomplish some nice clinical research, at the same time helping our 4th year students learn critical thought, problem solving, and communication. So Laura's study, I'm not going to steal her thunder too much, but I'll just take you through it a little bit. The idea for this actually came out of one of the studies that we did early on here, asking producers about some of their calf management practices, which was analyzed and written up by my postdoc, Christine Murray. And one of the things we found in that study was this number, which was quite surprising to us. So when we asked producers, when we asked producers how they resuscitated weak newborn calves, 60% of them told us that they hung calves from their hind end. So we'll walk through why that is and why it shouldn't be. So to understand this, it's sort of a little obvious, but going from living in a uterus to breathing air is a difficult transition, right? These calves have to go through a lot physiologically to make that change. And so one of the things that people have traditionally done is hung calves over gates because you get this really satisfying glob of goober comes out of their mouth and nose. And we used to think, yes, that fluid came out of their lungs, now they can breathe more easily. But the truth of the matter is that actually is coming out of the stomach, and hanging them upside down actually makes it harder for the calf to breathe. So it's been at least a decade now we've been trying to discourage people from doing this, and yet it's still happening a fair amount out there. And I think part of the challenge is that instead of telling people not to do something, it's easier to tell them here's something else to do, right? Giving them an alternative strategy rather than just saying don't do that. So that's where, along with the seeing what Daniel Pang had done with the rabbit, I don't know if you guys are familiar with the work he did with the rabbit LMAs, that's where this idea came from. So laryngeal mask airways are a device used in human medicine, oftentimes by paramedics or people that are trying to resuscitate humans in the field. So this is an LMA. Essentially it sits in the back of the throat. The tip of it kind of plugs the esophagus, and the opening kind of sits around the epiglottis so that you can breathe, you can ventilate air directly into the trachea of the person. And so when I saw what Daniel had done with the rabbits, I thought, well, I wonder if we could do this in calves for newborn calves that aren't breathing or aren't breathing well. And so the objectives of Laura's study have been to determine whether or not an LMA can be even used for ventilating calves, and then to compare it to the standard of care currently, which is this sort of device that's really mostly just used for collecting dust, but is essentially a mask with a gigantic syringe that is relatively effective at ventilating the esophagus and not so much effective in resuscitating calves. But that's really all we have at this point. So that's our comparative group. Hopefully the video will work. Maybe. Oh, it went black because I hit the wrong button. Let's see if I can make it work. So that's essentially the device. This was literally, I think, last week or the week before. Whoops. I'm not going to tell you the results because I don't want to get in Laura's way, so if you want to know whether or not it works, you have to come to the UCBM Research Day. She's also submitted an abstract to the bovine practitioners meeting next fall in Phoenix, so hopefully she'll get accepted for that and will be able to present her work there. So that's sort of the examples that I have in terms of contribution. And then last but not least, I think this position really requires collaboration. I don't see the chair as a way to advance one individual's career. I see it as a way that we can advance all of UCBM's clinical research, as well as hopefully improving beef research across Canada in general. So I think there's a number of different ways that this chair can collaborate. I think, of course, within UCBM, including our DVLC, I think is an important collaborator to engage with. With the other vet schools in Canada, of course, the other institutions within the province, industry groups, government agencies, and private companies as well. And I have collaborators in all of these different organizations, except for Olds College, and I hope to change that in the near future, given our partnership with them. So I think it's going to be important to engage with all of these different types of collaborators in a diverse and sort of broad way as this chair to really elevate the beef research across, not only internally within UCBM, but across the country. So those are my three components. I think I'm going to just close. This is a little cheesy, I feel, maybe, but I wrote these mission statements long before this position because I'm that kind of geek. So I just wanted to share them with you. So my mission statement is to advance evidence-based health management practices in the beef industry to improve cattle health, well-being, and productivity, to develop, conduct, and communicate applied clinical research in beef health management in consultation and collaboration with stakeholders, and to mentor research trainees, whether they're undergraduate, DVM, graduate, residents, postdocs, all across the spectrum, in applied clinical as well as epidemiological research. I want to say thank you to my trainees, because obviously none of this work would happen without them, as well as some of our technicians. I didn't list all my collaborators because I was afraid I might miss someone, but I did want to point out Ed, who has put up with me knocking on his door way too often probably, but he's been a great mentor for me. And then I want to acknowledge all of the funding agencies that have enabled this work, and particularly the Simpson Ranch Endowment that has helped with some of this already. And before you head for the hills, I would like to try and answer your questions.
Questions for Claire?
I should have taken more time. I left you too much time for questions. Yes?
So Claire, it is really a pleasure for me to listen to this and see the success from here to you and then out to the beef production.
Thank you.
I have no doubts about that, but I have to be a little bit critical.
There's always a but.
Yes, I have to be a little bit critical.
Sure.
See, what I do is I look on a daily basis at sequences and tissue culture, and so to see a real animal there is a pleasure. Where is the connection? Where is the connection to sequencing, to antibody development, and to molecular techniques in general? I know it is difficult.
No, it's a great question, actually, and I think that's actually one of my happy places, believe it or not, is when we can actually find those kinds of sort of mutually beneficial things, right? So we did a project, I didn't mention it because it was bison, but I had a grad student who was doing a bison study. She was going out to take blood samples from bison in the field. John Gilliard got a molecular parasitology project, and I was like, do you want some bison poop? Because we're going to be out handling bison, right? So we were able to give him the samples that he needed to do his advanced, fancy molecular stuff. And from that, we actually got a bunch of information on the parasite population in our bison. And we're actually getting, my student's going to get another paper out of that, looking at the management risk factors for parasite burden in bison. So I think there's some really cool opportunities. All it takes is conversations, right? And having those synergies where you guys are looking for samples, we're out in the field, why not partner up, right? I think there's some really cool opportunities. It's just, there's timing and all those kinds of things, right? But I think there's definitely opportunities for that. for sure.
So if I may, I think that is a great success story, by the way, the molecular characterization of the parasite. I was wondering about your colostrum uptake, and now that you have excellent buy-in there from the farmers, is there a follow-up story?
Yes.
Developing this now over a longer time period?
It's like I planted these questions with you.
Oh, I'm sorry.
I have a project that's funded that's looking at the specific antibody titers in newborn calves, because I think we look at colostrum broadly as sort of IgG, but we don't actually look at the specific antibodies often, right? So I think we need to understand, how our vaccine strategies influence the antibody titers in our calves and which antibodies are protective against disease. Sort of we know generally if you have IgG, it's going to keep you healthy, but in terms of our actual calves on actual ranches in Alberta, what do they need, right? Because some of them are still getting sick regardless of their colostrum consumption. So I think there's some basic questions in there in terms of the actual pathogens. And we'd written a cluster grant for the BCRC, which unfortunately wasn't funded. We were trying to actually get a better sense of which pathogens calves are facing, right? Because we know they're getting scours, we know they're getting respiratory disease, but we don't actually know which are the major disease-causing agents. So again, I think there's some opportunities there to try and figure that out, and partnering with people that do that kind of molecular work, I think is really, I think there's a future for that for sure. Yeah, thank you. So yeah.
So thanks Claire, it's really interesting. What areas are you interested in looking at in the future based on what you think we need out there in the field?
I think, well, the number of the times that I've done producer talks, one of the things that always comes up is how do I vaccinate my calves? How do I vaccinate my cows? So I think, the serology project that we're embarking on is really kind of a foundation for then trying to figure out what do we need to get into those calves and how do we vaccinate our cows and our calves to make sure they're protected. So I think that's sort of the next, it's like we get them on the ground, keep them alive, now what do we do to keep them through to weaning? So I think the vaccination stuff is kind of the next step that I want to embark on. I think there's also some stuff in terms of pre-weaning, how we get those calves ready pre-weaning, because obviously respiratory disease in the feedlot is a major issue, and I'm not sure, I think to do that, to effectively keep calves healthy when they arrive at the feedlot, we need to look at how they're leaving the ranch. So I think there's some weaning stuff that I'd like to get into eventually, which kind of partners with the vaccination stuff, right? It's like vaccinating them so they're immunologically prepared. That's the next.
Thank you.
Once I finish all this pain and caviar stuff. Don't want to do any more dystocia stuff, it's hard.
From Spy Hill, any questions for Claire?
Can you hear me?
Yeah.
Claire, just when we look at the great advantage on the dairy side with a national, record-keeping system like Dairycom, and in the past we've never had anything like that on the beef side to really benchmark performance from herd to herd as compared to national averages. With some of the collaboration with the herds that you've already worked with, do you ever see the prospects of being able to develop a beef type of dairy comp that would be such a huge advantage for tracking all this information?
Mm-hmm. Yeah, and I actually was, I think there are programs out there. The problem is that they're not, like Dairycom is universally, I don't know where to look. Talking to the air. I think Dairycom is universally accepted, which makes it very useful. The problem with all of our beef record-keeping systems is there's a lot of different ones, and they're not universal. So it makes it a lot harder. I think we're making strides in terms of things like VBP, which is the Verified Beef Production System. I think we have some more sort of industry structure challenges in terms of traceability and things like that the dairy industry doesn't struggle with quite as much. But I think some of the commercial programs that are out there, like Troy Drake's Herd Tracks, do provide opportunity. And I was actually chatting with Troy a few weeks ago now about whether there was a possibility to do like a data mining project with his system. So for those of you that aren't familiar, he's got, I don't know, he's probably got, do you remember it was 600 herds or something like that? on that system. It's an electronic record-keeping system. They have everything from calving records. They've got a bunch of genetic stuff in there in terms of parentage, or at least breeding groups. And so I was chatting with Troy about whether we could put a grad student on a data mining project, and he was really excited about that. It's not sort of a national benchmarking system. I think we're a ways away from that yet. But I think it would maybe give us at least a sort of more local sense of what's some of the stuff going on and what are some of the risk factors for disease.
Other questions from Spy Hill?
Oh, Michelle has one. Yes.
In the groups that you want to connect with and listen to, do you think there's a place for consumer groups? And
That's
as
a great
as a
question.
chair, maybe having a larger voice?
Yeah, I think that's a really great question, Michelle, and that's probably something I overlooked but should have included there. It's definitely a hot topic in the beef industry, right? It's sort of the voice of consumers. How much do we change our production practices to meet what they say they want versus how much do we need to communicate with them why we do what we do? And I think there's probably place for both of those things. So yeah, there's probably a role for that as well, because they're absolutely a stakeholder in the beef industry, right? If we don't have an industry, if people aren't eating beef. I don't know if that answers your question. I'm surprised Eugene doesn't have one.
Any other questions from Spy Hill? No. Did I see a hand go up here somewhere? Great.
I have another question.
Yes.
You talk mainly about cow-calf operations and things like that, and this is mostly of your research. What is the role, or should the beef chair also look at feedlot and develop some aspect of veterinary medicine and so on and so forth? And what are your thoughts about that?
Yeah. I've thought about that one a fair amount, because it's obviously, I didn't really touch on feedlot very much here. I think that's where the collaboration comes in. I think, you can't be good at everything. So I think probably as a primary sort of principal investigator, I'll probably focus on the cow-calf. But I think I know enough about feedlots, and I know enough feedlot producers and veterinarians to engage in a sort of intelligent way, I would think. So I would be happy to collaborate with people, and I think that's, as I sort of ended on, I think that's a big role for this chair, is to not just develop their own research, but also collaborate on projects like that. And I think one of the biggest issues facing the beef industry is that transition from cow-calf to feedlot, right? And I think I always kind of say, if the beef industry spent as much time worrying about that transition as the dairy industry puts on their transition, which is dry cow and lactated cow, we'd be way further ahead than we are right now. And there's obviously market issues and there's structural challenges to that. But I think that especially with antimicrobial resistance and some of the pressures there are on metaphylaxis, I think we're going to have to look at that transition. So I think that's where some collaborations in the future are going to be really important, right? It's not cow-calf and feedlot, it's a beef production chain. And how do we take calves through the whole process? So I see that as an opportunity for collaboration, for sure.
So what would the role of the chair then, in these aspects?
That's a good question. I guess really listening to various stakeholders, right? I'm starting to sound like a bit of a broken record, but understanding where the opportunities are is going to be an important part of this chair, right? So going to meetings, not just the CCA meetings, which tend to focus on cow-calf, but also Alberta Feeder Association and other types of meetings that are more focused on the feedlot, and trying to identify those bridges, as well as identifying who are the people that you can connect across that bridge. I would see that as a role of the chair. Confidently, I would see that as a role of the chair.
Do you think that the chair would have time to teach?
Yeah, that's always the challenge, right? There's like 200% of your time is occupied when you start sort of looking at all these things, and I don't think these things would necessarily happen overnight. I think it's a research chair, so there would be more research than teaching, but I think there's a good opportunity to do both, right? Graduate teaching undergraduate research teaching. There's ways to engage students in that. I would probably hope to still do some of my lectures. I don't want to completely lose connection with the DVM students because I think that's an important part of why we're here. But it's always balance, right?
Saw a hand go up in the back.
Ms. Calving.
Oh, yes, go ahead.
Well, it was sort of a similar question to what Michelle said, but I'll go ahead anyway. I'm just thinking this is like, it's a high-profile research chair. It's focused on the beef cattle community, and I'm just wondering what role you think you could play in and you may have answered this because I came in late, in connecting with those people who raise those cattle out there and promoting it as a research opportunity to help them. A long time ago I interviewed Jay Cross and he said the cool thing about UCVM is that we do research, we have the opportunity to do research based on what people out there in the community need to know. So I'm just wondering if you have some ideas on how you'll get that message out to cattle producers.
Well, I guess there's sort of two parts to the question, if I understand it, is sort of, and I did kind of cover this at the beginning, but that's all right. No, it's all good. I think there's sort of two sides, well, there's three sides to it, as sort of the, finding out what problems need to be tackled, right? It's sort of, I think as applied researchers, that's really important. So I think you have to talk to people, right? You have to go to meetings and sit at round tables and listen to people and go visit farms and spend the time drinking coffee, which obviously I do relatively well. It's actually just talking to people and listening and reading what's out there, I think is how you figure out what are the major challenges. And, I think that's what surveys and interview, like there's research methods to establish that as well too, right? It's sort of actually quantitatively asking people, what are your major issues? And then in terms of, I think the other part of your question is how do you communicate that back? I think there's no one way to do that, right? It has to be a multi-pronged approach because producers don't all learn the same way. Some of them want to come to meetings, some of them want to read it in the magazine. So you have to kind of try and get it out there as many different ways as you can to try and get it to them. And I think, the BCRC's done some research on how producers get their information, and it's still largely magazines, right? So I do a lot of interviews with people from Western Producer, Calving, and things like that, because that's really the best way to reach a certain group of producers. There's sort of, as many producers as there are in the province, there's that many different ways of doing things and that many different ways of learning, right? So I don't think there's any given strategy. You have to kind of come at it from all sides. You're media, you know that, right? Grilling me.
No. But as we look down the road and things are going all right, do you think there is a role of the Simpson Ranch chair with international cattle medicine?
It's a good question. If I remember the terms of reference for the chair specifically, I believe it is focused on Alberta first and Canada sort of nationally second. But I think when you build a reputation with an institution, so if we can make UCVM a leader in beef research, you sort of inherently become international because then you have collaborators that reach out to you, you have grad students that want to come here, you have students that then go out into the world and get jobs in various places. So I think the priority is local first, but then eventually I would see that ripple effect, hopefully reaching a more international audience and then hopefully becoming a more international collaborative type thing. That's just the honest answer. I'd like to say I would do it all, right? But it's just not. Yes, Herman.
So in 5 years, you're looking back, and when would you call this chair successful? What would be your parameters, or what would be your thinking? What would you want to achieve in those 5 years? And I know that's a difficult question, Claire, but
I think if people looked at a pool of applicants for a job they were trying to fill and they saw a UCVM applicant and they went, ooh, I know that student's gonna be strong, I know that person has good training, I think that's success. I think people looking at the type of work we do and going, oh, UCBM gives us really useful research. I can make decisions with my operation and change the way I do things based on the kinds of, or as a practitioner, I can change the way I do practice because of some of the stuff that comes out of here. I would see that as success. And then I think, having a strong network of beef health researchers within the province and within the country that maybe is spearheaded or strongly associated with the chair, I would see that as success.
Thank you. And you hit three more very important topics there. And maybe also the DVM students would be part of it.
And I include that in the employable graduates, right? I don't think that's just our grad students. I think that's our DVM students too, right? Whether you're a practitioner, a drug company, a university, to know that UCBM students are someone you want on your team, I think that's the goal, right? That's what we're trying for.
Any other questions, comments? From Spy Hill?
Yes. Claire,
Uh-oh.
I've noticed that your vision doesn't include anything clinical. Everything is sort of research orientated. I'm very sensitive to the question when a producer asks me, are you a real vet school? How would you answer that? What part of the Simpson beef chair includes a clinical component, either as a teacher or just as a veterinarian?
You hurt me, Eugene. I think the entire contribution section, the type of research that I want to do is clinical research, right? I think all the types of studies that I want to embark on include a component of them that is clinical, right? So it's things that will influence either how veterinarians, tools that veterinarians can use in their day-to-day practice, or tools that producers can use in their day-to-day operations. I think sometimes people forget that epidemiology is a clinical skill, right? Consulting practice is a form of practice, and it's not necessarily cutting and sewing or sort of administering drugs, but I think that's an important clinical skill for our future veterinarians to understand. So I guess I'm surprised that you didn't think any of that was clinical, because I think that's really what I'm trying to aim at. I think practice is changing, right? And we've had those conversations at length about how practice is changing. And I think, yes, our students still need to be capable of doing a C-section, but hopefully they're also, knowledgeable enough about how to, prevent the need for C-sections and how to advise their clients on breeding decisions and things like that, right? I think that's going to be more and more a part of production animal practice, and that's a challenge to get that all into a 4-year program still. But I think we probably still have some opportunities in terms of 4th-year rotations and things like that, in terms of advanced health management training for our DVM students, and that I could see the chair being involved in some of those things. We've already developed a graduate program on advanced beef health management, but I think having some of that trickle down into the DVM curriculum, there's a lot of strong health management stuff already happening in our curriculum. So some producers kept their own C-sections, right? So that's the world we live in. So.
Any other questions for Claire? If not, please join me in thanking Claire for her seminar and the discussion. You will receive an email from my office asking for your comments and feedback as you listen to these presentations over the next couple of weeks. That will be very helpful to the committee in making a decision. on this very important chair that they're trying to fill. So thank you very much. Have a good afternoon.
Are you all done with?
Let's clarify that.
Yeah.
You ship that out?
It's been for a couple of months. Like I said, the place in Caroline.
A long time. Oh, yeah, because then you could have just done it. Yeah. And that's always the problem, is the waiting.
And nobody was willing to
Waiting
start
for
shooting.
people to get, that's kind of where I'm at too. Waiting for people
And I
to
did
be back in place, so that I can analyze.
results on type checks, but I was a little bit worried about that because that area is
Oh my gosh, and you should know how to get.
yeah, yeah. Never a dull moment.
Never told me.
Yeah.
Sorry. Oh my gosh.
I'll have fun in the process.
Yeah, but first.
Yeah, they're gone. You'll have results soon, hopefully. That's just the waiting game, though. I know. Yeah.
Absolutely, I know we're always done by 4. We've got 3 or 4, yeah, 3 days.
Oh my gosh.
And then yours.
I think he was meaning like
Actual hands-on.
no, I think he was talking about like residency.
Sure.
That was probably the door you opened.
I
I
said
think
we should
that's
be
what
done
he was
by 4.
but I didn't know how to be like.
Oh, yeah, no, which I totally.
So then she's just gonna figure out something
Opportunity,
to do
because I
between 13 and 14.
I wanna relaunch the Simpson Fellowship.
That's great, yeah, you bet.
So, yeah, no, that's a good point, I missed that opportunity.
See you, Christina, thanks for coming.
Oh, yeah, that would have been a good opportunity.
You should have telepathed me more, harder.
So is Jen gonna get involved in that March 1st gathering?
Yes,
That'd be
well,
great.
maybe, I think so.
Oh,
When Eugene is
I was like,
doing-
March 1st, what's happening on March 1st?
Talking about how to better.
It's just the fourth years come home twice during their fourth year, and so it's, I think it's a relatively informal session
Yeah.
of like,
Oh, yeah.
what have you guys been up to, and tell us
Just
about your
a-
cases.
Yeah,
and-
just some really informal.
rounds.
And we're just gonna go off in the faculty lounge, so we have a separate venue, so we're not trying to compete with. You can have, do it in the student lounge, well, that's kind of, I mean, people are gonna chat,
Yeah.
which is what they should do there,
Yeah.
that's fine. But we need just a separate place, whoever wants to come and get a handful, at least, I'm hoping at least a handful of our faculty, and just have a chance to interact, and say, what have you folks seen, and what about this, what about that, did you think of something else, and, you know.
I said to Eugene, I was like, one of my grad students is worried that her clinical brain is withering, so can she come too? And he's like, absolutely.
Use it or lose it.
Sorry.
Yeah.
Oh dear. Been there, done that, got the t-shirt, can't remember, yeah. Yeah, that's kind of the sequence, so anyway.
Yeah.
Oh dear, anyway, do that as it may.
Yeah, you don't have to if you've got other stuff to do, but I just thought it
No,
was an
I put it
opportunity.
in my
It's from 4
calendar
till
already,
5.
so
4 till 5.
Okay,
Yeah,
perfect.
you bet.
These are all
So-
things that you
And at
can
this
put in
point, I don't know how many students we have involved, but Janet in Student Services, or our lawyer or somebody was gonna. maybe
Because it's
lawyer.
not just the PHAOE students, right? It's anybody who has a
That's what
PH
I
case
said,
they
I
wanna
said
come.
anybody that was not.
Wants to come hang out with Jensen. I was always worried about his questions.
Years ago,
Can't miss
Jansen
them all.
said we had a busy day and, you know, saw lots of cases, he was on field service, and end of the day, he's gonna treat something, and the student said, Dr. Jansen, that's not the preferred drug for that treatment, for this issue. He said, by God, it is, and it's all you got in your car.
That's right. When you've used everything else.
When you're out of